Hi, my name is Christian Howes, and I'm an attachment-based psychoanalytical psychotherapist. So how do the two models of psychoanalysis and attachment theory, how do they complement each other in psychotherapy? Well, the psychoanalytical model that relates to the work of Freud, Klein, Donald Winnicott, Jung, many others, and they basically emphasize the importance of interpretation in psychotherapy, in analysis. So interpretation of what a patient is bringing, the content, but what's implied in the content, maybe what they're not saying. And this involves a reading of the choice of words, where they might be holding back, their body language, lots of different sort of perceptual observations, but also the therapist's own body was important to interpret a patient's needs, I guess. So that's called countertransference, where a therapist kind of feels certain senses, emotions, physical feelings, depending on what the patient is bringing to the therapy. So that's a bit about psychoanalysis and the attachment model. Well, that relates to the work of John Bowlby and his contemporaries, one being Mary Ainsworth. They developed various different attachment patterns which can help us understand how we relate to stresses in relationships. John Bowlby really drove home the importance of relational security and the importance of relational security for exploration. So if you take the parent-child dynamic, when a child feels contained, secure, understood, and cared for adequately by their parent, they're more likely to go and explore, basically. They're more likely to be curious, exploratory, and able to learn from their experiences. They're equally as likely to detect threat in the environment as well, and when they do, they can safely just go back to their parent, knowing that they'll be able to contain their anxiety. So that's attachment theory in a nutshell. In therapy, it's similar, analogously to the parent-child relationship, in that the therapist is the container and the secure base. And they do that by attuning to the needs of the client, showing them that they understand what's going on for them, and that what they're going through is part of a defensive pattern that can be worked on to sort of, to help make relationships more bearable for them. So essentially, once relational security is cultivated in the therapeutic relationship, then the client can not only explore on a deeper level some of their their difficulties and fears and memories and so on, but they can also be a little bit more exploratory in the wider world, knowing that the therapist has kind of got them in mind, they understand what's going on for them, and they've got a few of the tools that they sort of learn in therapy to sort of navigate difficult relationship experiences. So there you go, that's how analysis and attachment theory complement each other. You've got interpretation, countertransference, picking up on implied meaning, and you've got the attachment theory, which is creating relational security with which a patient can go on and kind of explore their relational world.